My name is Jatin Gupta. I am your ESP. I am 21 years old. Yes, thank you, ESP. So today I am going to perform your total neurology examination. So for that you will need to different technique. So just follow my instruction. Okay. So during examination, if you will feel any discomfort, just let me know so that I can stop the examination. Okay. So we have completed 12 remember. Now we are going to perform complete sensory reflexes test.
For pain, use sharp safety pin the stick portion of the broken cotton swab. The patient, is this sharp or dull? Apply the lightest pressure needed for the stimulation to feel sharp. Avoid heavy pricks that draw blood. With fine wisp of cotton, touch the skin lightly, avoiding pressure. Ask the patient to respond whenever your touch is felt. To compare one area with another, avoid testing in which is normally relatively insensitivity. Vibration, use relatively low pitched tuning fork of 128 Hz. Tap it on the heel of the hand and place it firmly over the distal interphalangeal joints of the patient's finger. Ask what the patient feels. Patient to tell you whenever vibration stops. Tap it on the heel of your hand and place it firmly over the interphalangeal joint of the big toe. For proprioception, grasp the patient's big toe by its sides between your thumb and index finger and pull it away from the other toe straight up and down as you move the patient's toe clearly upward and downward. With the patient eye closed, ask the patient to say up and down whenever moving. Repeat same procedure in wrist joints and elbow joints. Discriminative sensation. The stereognosis refers to the ability to identify an object by feeling it. Place a coin in the patient's hand. Ask the patient to tell you what is it. A patient will manipulate within 5 seconds. Anesthesia is the test to ability to identify the number but end of pain number in patient's palm. Normal person can identify most such numbers. 2-point discrimination, using the two ends of two pins, touch a finger pad in two places simultaneously. Hit the double stimulus irregularly with 1-point touch. Be careful not to cause pain. Point localization. Briefly touch a point on the patient's skin, then ask the patient to open both eyes and point to place touched. Normally, a person can do so accurately. In extension, stimulate one side, corresponding areas on both sides of the body. Ask where the patient feels your touch. Normally, both stimuli are felt. Biceps reflex. The patient's elbow should be partially flexed and the forearm pronated with palm down. Place your thumb finger firmly on the biceps tendon. Aim the strike with the reflex hammer directly through your digit towards the biceps tendon. Observe flexion at the elbow and watch for and feel contraction of the biceps muscle. Biceps reflex. Flex the patient's arm at the elbow with palm towards the body. Pull it slightly across the chest. Strike the triceps tendon with a direct blow directly behind, just above the elbow. Watch for contraction of the triceps muscles and extension at the elbow. Brachioradialis reflex. The patient's hand should rest on the abdomen or lap with the forearm partly pronated, strike the radius with the point of the flat edge of the reflex hammer about 1-2 inches above the wrist. Watch for flexion and supination of the forearm. Quadriceps reflex. Briskly tap the patellar tendon just below the patella. Note contraction of the quadriceps with extension at the knee. Placing your hands on the patient anterior thigh, let you feel this reflex. There are two options for examining the supine patient. Supporting both knees at once allow you to assess small difference between quadriceps reflexes by repeatedly testing one reflex then other. Supporting both legs is uncomfortable for you or patient. You can place your supporting arm under the patient's leg. Some patients find it easier to relax with this method. Ankle reflex. Partially dorsiflex the foot at the ankle. Persuade the patient to relax. Strike the Achilles tendon and watch and feel for plantar flexion at the ankle. Leg at both hip and knee. Rotate it externally so that lower legs rest across the opposite shin. Flex the foot at the ankle and strike the Achilles tendon. In clonus, support the knee in a partly flexed position with your other hand. Dorsiflex and plantar flex the foot a few times while encouraging the patient to relax. Then sharply dorsiflex the foot and maintain in it dorsiflexion. Feel for rhythmic oscillation between dorsiflexion and plantar flexion. Superficial stimulation reflexes. Test the abdominal reflexes. Bite lightly by stroking each side of the abdomen above T8, T9, T10 and below T10, T11, T12. In plantar response, with a key or wooden end of the applicator stick, stroke the lateral aspect of the sole from the heel to ball of the foot, curving medially across the ball. Closely observe the movement of the big toe, normally plantar flexion.
Completed neurological examination. So thank you for being cooperative. So as I have seen, there is no difference. Okay. Thank you. Have a nice day.